Hi folks, it's Wednesday the 23rd of August 2023. Just a wee health update on how things are going. I had an appointment at the clinic yesterday on the Tuesday, that was 22nd, and they decided that because I'm now 15 weeks post-op, that I can come off some of my medication. So they took me off 4 medications yesterday, which amounts to 5 tablets per day, plus they made a change to one of my strong painkillers, which makes it 6 tablets less per day I take. I still take 18 now. It's 18 instead of the 24, but on the good side is they are reducing the tablets, so that's all good news. In another 3 months, by another 3 months' time, I should be off about another 7 tablets. So, because the other ones there are anti-rejection drugs and a couple of others that required long term. But all in all, I should be down to hopefully no more than 11 tablets per day in the next 3 months. So that's all good news. Plus, I spoke to the dietitian because I've put on 2 kilos in 4 weeks, because the last appointment was 4 weeks ago. So I put 2 kilos on, well, 2.5 kilos to be exact, and that annoyed me. So I wanted some advice on how I can work on getting that sorted, taking it off again. Again, it's all down to my mental mindset. Plus, one of the medications I was on was a steroid. So hopefully now that I've been taken off that completely now, although it was reducing since my transplant 15 weeks ago, I'm now off that, because you've got to wean yourself. You've got to be weaned off it, as opposed to stopping it immediately. So I'm now down to no steroid to take that way. So hopefully that will reduce my sweet tooth, my appetite, and hopefully get the back on track and get losing the weight again. So and just to get my butt out the door and do some bit more walking. Push myself out my comfort zone. Although try and walk about 1.5 miles a day. It doesn't happen every day if it's bad weather, but I need to just try and get myself more motivated and get out there. Because I do have a treadmill, but I've just not got it sort of in my head to go out and use it just yet, because I've just not done it. So now the plan is to get that up and running at the weekend, just so that I can then walk on the treadmill if it's bad weather outside, and force myself, now that I've started back to work, just to get up and go for a walk at lunchtime. And because I usually go for a walk in the morning, but if it's raining I don't go. Then I'll walk at night time after I log off. But she says get out and get yourself walking during the lunchtime as well. I don't usually take a lunch break, but it is a good reason not to sit at the computer and just get up and walk. So that's all good. And both the consultant, the transplant coordinators, nurses, and the dietitian all think I'm absolutely doing fantastic and well exceeding their expectations at this stage, based on how seriously ill and sick I was beforehand. So all good news, and onwards and upwards. And I think we'll leave it there, and I'll update you later. Right, thank you guys. Bye.